And we'll go live now. We'll give it just a few minutes to allow folks some time to join before we get started. Ms. Brenda, do you mind hitting mute on your audio for now?
Sure.
All right. Good evening, everyone. Welcome to tonight's live online event with Greenlight Bookstore. I'm Jessica, one of the co-owners of Greenlight, and we are so honored to be the host for tonight's informational forum on COVID-19 presented by the Prospect Lefferts Gardens Neighborhood Association. Before we start, I just want to say a huge thanks to the folks at PLGNA and our panel of experts tonight for giving us their time for this discussion, and to all of you for showing up. Though we're not able to host events in our store spaces right now, our community is still here. We're grateful for your support and for the chance to make space for important conversations like this. So just a couple housekeeping things before we get started. In our Zoom webinar tonight, you can see and hear the speakers, but they can't see and hear you. They can see that you're here though, and you can see a count of fellow attendees on the top of your Zoom screen. There's a couple different ways you can interact with the panelists and with each other throughout tonight's event, which we do highly encourage. The first one is the chat, which you can find by clicking on the icon that looks like a speech balloon. You're welcome to post your comments and thoughts in the chat. It's a great way to show your appreciation and interact with fellow attendees. If you have a specific question that you'd like to have answered by the panelists, please post that question in the Q&A. You can find it by clicking on the icon that looks like two speech balloons. We'll be pulling questions only from the Q&A to be answered in the later part of the program. We are recording tonight's event, so look for video or audio versions on our social media channels later on. Unlike most of our virtual events, there's no featured book to sell tonight, but if you'd like to support your local independent bookstore and allow us to continue to bring you books and programming for the neighborhood, you can shop in our store locations on Flatbush Avenue and Fulton Street, 12 p.m. to 7 p.m. every day, or shop online at greenlightbookstore.com, and we thank you for your support. So please allow me to quickly introduce our panelists for this evening in the order they'll be speaking. Rose Strickland is a retired professional nurse, an 18-year resident of Lefferts Manor, and the mother of 3. Carmen Castillo-Barrett is a science educator and executive director of the Brooklyn-based nonprofit Kitty Science. John Quale is an infectious disease physician at NYC Health Hospitals at Kings County Hospital. And your moderator from this evening and the primary organizer of this event is Brenda Edwards, who's the president of the Prospect Lefferts Gardens Neighborhood Association and a longtime resident of the neighborhood. We'll be hearing from each of the panelists tonight about what we know now about the COVID-19 vaccine and the historical factors that contribute to vaccine skepticism among Americans in general, particularly communities of color, and then they'll be answering your questions. We're going to start off with a video featuring our panelist, Rose Strickland, from Spectrum News titled "Vaccine Reluctance, A History of Abuse Breeds Mistrust." So please watch the video and we'll then hear from Rose herself and from the other panelists. Bear with me for a little moment while I get that video started.
What I was seeing was just sort of tearing at me at that time. The doctors, the nurses, the activity in the ICUs, the wailing of the ambulances. It was otherworldly.
Gut-wrenching even for a retired nurse like 81-year-old Rose Strickland with 42 years experience.
I know what fear is. I know the stress. I have owned patients.
So she did what she knew she could, enrolled in Moderna's COVID-19 vaccine trial, and encouraged all 3 of her children to participate in COVID vaccine trials too.
I felt the need to do something other than watch the news and shelter in.
As a woman of color and a senior, 2 groups disproportionately burdened by the pandemic, Strickland also recognizes the significance of her participation.
I have to be in it if I want some assurance that when a vaccine is developed, it will be as valuable for me and people who look like me.
All right, I'm sorry, folks. We were having some audio issues, and I really want you to be able to hear this the best you possibly can. So we're going to start that video over. We're about a minute in, and we're going to just play it from the beginning with better audio this time. Thanks for bearing with us.
What I was seeing was just sort of tearing at me at that time. The doctors, the nurses, the activity in the ICUs, the wailing of the ambulances. It was otherworldly.
Gut-wrenching even for a retired nurse like 81-year-old Rose Strickland with 42 years experience.
I know what they're feeling. I know the stress. I have pruned patients.
So she did what she knew she could, enrolled in Moderna's COVID-19 vaccine trial, and encouraged all 3 of her children to participate in COVID vaccine trials too.
I felt the need to do something other than watch the news and shelter in.
As a woman of color and a senior, 2 groups disproportionately burdened by the pandemic, Strickland also recognizes the significance of her participation.
I have to be in it if I want some assurance that when a vaccine is developed, it will be as valuable for me and people who look like me as it will be for anyone else. If we don't have our gene pool in there, how are we going to know whether it works for us?
But so far, Strickland and her children acknowledge they may be the anomaly within their circles.
When I speak to my friends, people I know, my neighbors, most of whom are well informed, they're not biting at the bit. One of my closest friends says, I'm going to wait.
Why do you think that is?
She said, I'm going to wait to see if you grow a tail.
I mean, we don't know.
Yeah, I'm finding
absolutely.
reluctance as well here on Miami Beach.
Experts say the mistrust can be seen in the lack of diversity among vaccine trial participants. So far, efforts to diversify the national COVID-19 trial registry have fallen short of the goal for it to reflect the distribution of disease burden within the population. According to the NIH Registry for COVID Trials, less than 12% of participants are Black or Latino, while the CDC says of cases where race was recorded, more than 37% are Black and Latino. Strickland points to the past.
Is there any wonder that they might not be the first people willing to, their way of thinking, be used as the guinea pigs?
The abuse of Black slaves in medicine, where they were used as subjects of experiments, is well documented. The scars run deep, even as effigies of scientists once celebrated for their medical breakthroughs are ripped down in recognition of the crimes committed in the name of research.
It is not just the legacy of the way Blacks have been treated. It is the current day experiences of discrimination in the healthcare system that reinforce that mistrust.
As public health and political leaders struggle to find ways to convince Black Americans and other affected groups prioritized in distribution plans that the vaccine is safe, there's concern that others who shouldn't gain early access to the vaccine will fill the void.
One of the things I worry most is that, people who need the vaccine the most aren't going to get to be the people who get access to it.
In order to build necessary trust within Black and Brown communities, experts like Richardson are calling for an unprecedented level of transparency, like allowing independent, locally respected experts to fully vet vaccine data. The Strickland family, too, says candid, clear communication of what people can expect from the vaccine would also help. As for Rose Strickland, she will continue to do what she sees as her part, remaining in the Moderna study for 2 years.
I think it's an honor to be a participant in a study for a vaccine to control a disease that is just devastating.
And she says she hopes lessons were learned, that building trust in the healthcare system and in vaccines requires institutional change long before a crisis strikes.
Until you have people who look like us at the CDC, out front scientists, healthcare executives, at the national, local, state level. You can't wait until we're in the midst of a pandemic.
Over to you, Brenda.
Thank you so much, Rose. You know, that was really touching, and in 5 minutes, I think I learned more, and so many things were brought up that we have to discuss and, actually build on, what's in that the article as well as the clip. So, we'd love to hear more about your experience, more of what drove you to, to take part in this, and to let us know if anything changed, so far. I think you're on mute. Can I check on you?
You can't. She has to unmute yourself.
Okay, there we are. Good evening, everyone, and thank you for allowing me to join you. My journey started upon my return in March from a winter in Florida to find that I was one of 13 passengers on an airplane. I arrived at the Marine terminal where I stood alone at the baggage carousel, which never turned on, and exited the terminal and found that I was the only person waiting to be picked up. That was my introduction. Though I had heard about it while on vacation, it was this stark stillness. At home, of course, I isolated. I listened to news. I watched as the disease spread and consumed our not only our state, but our city, and particularly right here in our backyard. In early spring, I received an email from Moderna asking if I would be interested in participating. And as soon as I could hit the reply button, I did so. I forwarded that email to my 2 daughters, one of whom lives in Atlanta, the other one on South Beach, and my son who lives here in the Manor. And I said to them, you need to be in this. All of us enrolled. The Moderna study is a 2-year study. The requirements were, or are, I needed to make a total of 7 visits, 2 visits for the study vaccine, and then 4 visits within 6 months of receiving the vaccine. And the final visit is to be made 1 year, or at the end of, at the end of the 2-year study. It is simple. The longest time I spent at the site was maybe an hour. Nasal swabs, blood collection, answer some questions, and that was it. I received I was unblinded approximately 2.5 weeks ago. I received the first dose of the vaccine and will receive my second dose February 12th. I personally did not have any side effects after receiving the vaccine, my first injection 2 weeks ago. There was some slight soreness at the injection site, but apart from that, it was, there wasn't a problem at all with it. I encourage as many people, especially those of us who are in minority populations, to not only educate yourself about what the vaccines are, but if it is available to you, to perhaps consider joining a study. More than that, I feel at the end of the day, for me personally, it's a civic duty. The scientists have been working on these vaccines for years. This is not something new. And I want everyone to understand, for every vaccine we've ever gotten or will get, years of research goes into it. And in the final stages of that research, we have to you have to have human participants to ensure that the vaccine is safe, that it is effective. This is not new. How many of us take flu vaccines yearly? It's worth asking oneself, where is the greater harm or the greater risk in taking the vaccine or taking your chances? And I will leave it there.
Thank you so much, Rose. Thank you. We needed to hear that. So now we have Ms. Carmen, a science educator, among other things, and been educating the community also about the COVID and the vaccine, and is also a part of the study. And she'll, briefly tell us her journey. Thank you.
Thank you so much, Ms. Brenda, and good evening, everyone. Thank you so much for having me. I am commonly known around the community as Ms. Carmen. Early on in the pandemic, what I was aware of, even beforehand, was that access to education and a connection with science was going to play a really big role with how people behaved and the decisions they made. So initially within my students, and this is a rather young group of students, I initially aimed to just teach them about germs and just basic hand washing, cover your cough. But of course, we all know things spiraled very quickly out of control in March and April. And so that was not sufficient to meet the needs, not just of my community of families, but the community I live in and the community that I serve. And so I started doing more community outreach type of videos. And this involved talking about epidemiology and what does it mean when these numbers are spiraling so out of control, and what are the consequences of that. And what happened very quickly from that was a lot of questions. Seemingly basic questions, which pointed once again to the fact that there's a lot we don't talk about. And so when we're discussing vaccine hesitancy, particularly among people of color or immigrant communities who don't speak the language, we really need to also acknowledge that there's a gap in understanding science, in connecting with science, and being a part of it. And so being an educator, I did two things. I decided to educate the community more and really get into the nitty-gritty of what does it mean to get a vaccine? What is the job of a vaccine? What's in a vaccine? Just really getting into the details of that. And then I felt compelled, like Ms. Rose, to really take it a step further. And I'm well aware that the Black community is severely underrepresented in vaccine studies, and particularly Hispanic women are underrepresented in vaccine studies. And so I volunteered to be involved in one. And so back in October, I officially enrolled in the Astrazeneca vaccine trial. It's currently in phase 3, so it's not any of the vaccines that are currently under emergency use authorization, but it's equally as important because it may be a third or fourth option for us. And so for me, I acknowledge that these concerns and this vaccine hesitancy is completely understandable and well-rooted in things that are happening right now. But as a person of color, I also need to take advantage of the resources that we have. And as a science educator, that engages me in making scientific decisions. And so a vaccine is right now our greatest offense in this virus. We don't have a treatment per se, and we don't have a cure. So what do we have? Well, we have a way to prevent severity and hopefully prevent or reduce transmission. And so I see that as a tool. And I will certainly encourage everyone to take advantage of that tool and resource because right now our lives depend on it. But I do still want to acknowledge that it's okay to still feel hesitancy. But also we do have a responsibility to take advantage of the health resources that we have available because unfortunately we already have a lot stacked up against us.
Thank you, Carmen. Yeah, I have to say that I did, it was helpful to me to see what you were doing for the community, on social media, and shame on me because I don't think I'm as smart as a 5th grader. So I have to really do a lot more studying, but thank you so much. So now, Dr. Quale.
Hi, everyone. Again, thank you for inviting me. I've been in, you can hear me okay?
Yeah, can everybody hear?
Okay.
Yes.
So like I was telling the other panelists, I've been at Kings County Hospital for about 40 years in one form or another. And I started my career with the AIDS epidemic, and I'm ending my career with the coronavirus pandemic. It's been quite a journey. I hope tonight we dispel some of the misperceptions about the vaccine with this group. I get asked an awful lot of questions regarding the vaccines by my coworkers as well as my patients. Some of the questions that come up that regard safety, you know, the vaccines that we have available will not give you COVID. You will not grow a tail, like I've heard that from people. The vaccines do not get part of you. They do not get into your DNA. They don't change you at all. These vaccines are very safe. The clinical trials with the Moderna and the Pfizer vaccines, those are the two vaccines that are currently available through the FDA emergency use authorization. They enrolled tens of thousands of patients. These were multinational studies, and there were no red flags that came up regarding the vaccine.
I'm sorry, Dr. Quale, to interrupt you.
Sure.
We really need to hear your presentation, and it's there's some problem with the sound. I'm not quite sure. It's like a feedback.
Is this any better?
Yeah. I think that's better. Yes.
Okay. So I just want to emphasize the safety part of the two vaccines that are available, the Moderna and the Pfizer vaccine. They, like I said, I get asked a lot of questions. They do not become part of your DNA. You do not get COVID with these vaccines. I've heard that people grow tails. I've heard that as well. That is absolutely not true. These vaccines are extremely effective, 95% efficacy in preventing people from getting COVID. You're not going to get much better than that with vaccines. So I think like many people in the audience, I was cautious with the vaccines because I wanted to see the data. But once the information came out, the decision was very easy, and I was one of the first ones to get the vaccine. Like Rose was saying, I got a sore arm for a day. It was like getting a tetanus shot, you know, really no different. I got both doses, and I'm really glad that I did. Many of my coworkers have gotten the vaccine, and we all do it for our families, to protect our families, to protect our coworkers, to protect our patients, and also to protect ourselves. So, I really encourage people to get the vaccine, and I hope with the questions and answers we reduce some of the fears that people have with the vaccine. So I'm encouraged and looking forward to the questions.
I didn't realize I was on mute. Thank you so much. I'm anxious too for the Q&A, and Jessica will read the questions.
Thanks, Brenda, and thanks so much to all of the panelists. I've put us in gallery mode now so everyone can see all of your faces, and I'll be the representative of the audience to ask some of these questions. So please remember to unmute when you're answering the question, and whoever feels like they would like to can speak up. So the first question at the top of the list is from Laura Diamond, who says, thanks for hosting the event. She says, I have a question about the Kings County COVID vaccine clinic. How is social distancing being handled at the site? Are there lines outside the clinic, or are lines of people waiting mostly outside the space? Is the clinic a well-ventilated place? Also, how are any possible allergic reactions handled? I can repeat any of that if you need.
Sure. I mean, the T building is where the vaccine is being administered. It meets all the safety requirements. You can actually go online and see what the waiting time is for both testing and the vaccine is by appointment only. So there should not be much of a waiting line outside. And it meets all of the criteria for social distancing and air ventilation and everything else. Yes, it's a safe environment.
And the question about how are any possible allergic reactions handled?
Okay, so they do have a crash card. You know, they do have epinephrine available on the very rare chance that there's a serious allergic reaction. It is right next to the main hospital, so I mean, there's plenty of people around should there be any adverse reactions to the vaccine.
Thank you. There's another question from Virginia Bechtold, who's a board member of PLGNA, and she's quotes from an email that PLGNA received that says, quote, listening to the repeated narrative that there is widespread distrust of the vaccine among BIPOC, I wonder what the current statistics show. Are other factors having a tremendous impact on the low vaccination rate? Factors regarding access, obtaining appointments, supply, locations, transportation, etc.
So I would say all of the above have played a role. Certainly as the rollout has been happening, there have been less appointments available, but then the appointments are available online. And then are you savvy enough to navigate that site? So I think the setup of making the appointment to get the vaccine already is an obstacle within itself. So I would say all of the above are playing a factor in affecting in the vaccination rates among people of color.
Anything to add?
I'm actually encouraged that we ran out of vaccine so quickly. You know, and as we get more, I hope that, you know, the distribution becomes more efficient, and as the requirements of who can get a vaccine start to expand, you know, I am encouraged that that there's a demand out there, and hopeful that that continues.
So that connects to a question by another PLGNA board member, Deborah. Deborah says, the problem now, apart from skepticism about the vaccine, is distribution. What can any of the speakers tell us about its current and anticipated availability?
I'll say I don't know. I mean, I think it's becoming a manufacturing issue now, and they are doing everything to speed up manufacturing. I am hopeful that that there's going to be more vaccine as time goes along, and certainly with the other vaccines that sound promising, the Astrazeneca and the Johnson & Johnson vaccine, those will be welcomed additions and should greatly improve our ability to vaccinate the public.
Great. Here's a question. Oh, sorry. Go ahead.
I just want to read a little bit what Senator Myrie, I think we did say that he was not able to be here tonight. That
I didn't mention it, Brenda. If you would explain that, that would be great.
Yeah, Senator Myrie, Zellnor Myrie, was partnering with us, and he came down with COVID. So his schedule is very limited and wasn't able to be here. You know, he wanted to greet people, but he did post, I saw this was from yesterday, he did post on Facebook that over the weekend, Governor Cuomo, Representative Yvette Clarke, and Representative Hakeem Jeffrey visited several NYCHA developments across the city to distribute nearly 1,000 free COVID-19 vaccines to eligible seniors. And he said, I was pleased that some of these vaccines were given at the Reed Apartments in Crown Heights. And he goes on to say that he hopes that this rollout will continue, and that it was essential, especially in poor neighborhoods and neighborhoods of color. So I was happy to see that and that distribution.
Absolutely.
May I also add that distribution, I have heard very little about people who are homebound and unable to get to a distribution center. Are any efforts, and I'm sorry to hear that Senator Myrie is himself ill, but it was one of the questions. There are so many questions regarding the entire mechanism, the system from day one. Storage, distribution. A biggie is vaccinators. The vaccine seems to be the part that everyone is concerned about. Its safety and efficacy, and I understand that. That makes sense. But here we are, 1 year in, and in many ways we've been caught flat-footed. How is it a city, one of the greatest cities in the world, with the type of resources we have, after having dealt with AIDS, and how do we find ourselves without the proper facilities, without the infrastructure? Where are the answers? How is it that we have developed a healthcare system that focuses on illness rather than wellness and the maintenance of health, instead of the resources going to the treatment of illness? And I would love to hear from our representatives what efforts are being made to address this problem. I'm old enough to have remembered polio. And to find ourselves at this point with folks, we're sort of, I feel in many ways we're running around like chickens without heads. Who's going to do it? Where is it going to be done? In many ways, the vaccine itself is the least of the problems. The education of people, the distribution, the storage, the documentation, the data storage, the data processing, all of these are a part of any global, certainly, pandemic. How is it we are so unprepared for this? And I'm sorry, but these are some of the issues that we need to be addressing. There are many people who will not be able to get to any site. Will there be mobile units? What do we have in the way of vaccinators? Even if we had, if, as the president says, he's ordered the vaccine. Once we have the vaccine, then what?
Thank you, Ms. Strickland. That's a great point. And I wonder, Ms. Edwards, if we might have another session with some of our elected officials and discuss some of the issues as well.
We have to, definitely.
All right, we still have about a dozen questions in the Q&A, so we'll see if we can get to some of them, but some of them may be open-ended as well. Here's a question from Kenya. Kenya says, good evening. Can you please explain what herd immunity means and what it means for us as the vaccine rollout continues? Maybe that's a question for Ms. Carmen.
Thank you, and that's a good question. If you go on our Instagram, we recently did an infographic covering this under the term community immunity. And that I think is helpful to thinking about the people you live with and around. And the goal of community immunity is to get enough people who can be vaccinated to be vaccinated. And so that gives the virus or whatever pathogen you're vaccinating against just less hosts to be to replicate in. But it also allows the small percentage of people who can't be vaccinated, because there's always going to be a small population of people who just cannot be vaccinated. It protects them because they don't have a choice. But those of us who can get vaccinated should, in order to reach a threshold. And so when we're talking about COVID-19, I believe we're aiming for about 70%, and not 70% of Brooklyn, but we're talking about 70% of all of the population, and we're talking about the world. So we have to put on our teamwork hats here and work together, because that number will help us reach the minimum community immunity or herd immunity. And that, I think, will be the biggest game changer of all, because Ms. Rose does bring a good point. We have the vaccine, but having the vaccine doesn't mean anything if you have not vaccinated the population that can be vaccinated. And then on top of that, you do want to aim for a very high threshold. So that's the basics of what you're aiming for with herd immunity or community immunity.
Thank you. It's good to have an educator on the panel. Anything to add to that? All right, here's a question from Marina. Marina asks, is there any statistical data available about the side effects of the vaccine, and specifically ethnicity of people who reported the side effects or types of side effects?
Okay, I'll chime in. About 90% of the people will develop a sore arm. The majority of the people, anywhere from 50 to 80% or so, may develop muscle aches, chills, fatigue that may last 2 or 3 days. To my knowledge, there is no difference in terms of efficacy or side effects regarding ethnicity or racial background. Oddly enough, older people tend to tolerate the vaccine better than younger people, especially the second doses of the Moderna or the Pfizer vaccine. But again, the side effects are relatively mild and last a couple of days at most. And so.
Go ahead, Ms. Carmen. I think you're raising your hand.
Okay, yeah, I'm a teacher. I'm used to the whole hand raising. I just want to say that was what Dr. Quale mentioned. That was what I was informed of in terms of what to expect as a participant in the vaccine trial. But of course, you are also informed of adverse effects. So we do have to acknowledge that there's basic side effects, because we're kind of waking up and ramping up your immune system. So something is happening. So you will feel some effects of that. But then, separate to that, there are adverse effects, which are more rare. But Dr. Quale covered the more common ones. And to me, it was described as, I may expect to feel flu-like symptoms, early flu-like symptoms And that's kind of, I guess, average in terms of effects from a vaccine.
Thank you. Oh, go ahead.
Sorry, just some questions have come up regarding the allergic side effects as well. They've been pretty rare since the vaccine has rolled out. The rates of serious allergic reactions seem to be around 2.5 to 10 episodes per million doses of vaccine administered. And there are certain people that probably should not get the vaccine, but those people are few and far between. And so I'm sure that most people have heard about the allergic reactions in the news, but they're very rare and should not be a deterrent to get the vaccine.
So here's maybe a related question from Ada Terry. And Ada says, in Norway, several elderly people passed away from the vaccine. My mother will be 99 this year. Should she get the vaccine?
I think absolutely, definitely. Anyone who is eligible to get the vaccine should get the vaccine. I think that when we hear about people who either get sick or die immediately after getting a vaccine, it's easy to try to draw lines and try to correlate that. I think the question we need to ask is that an event that would have happened anyway, even without the vaccination, and explore it separately and kind of see where that gets you. In terms of my knowledge, there is not a direct correlation between getting vaccinated and then dying of the vaccination. So I would say, yes, she should definitely get vaccinated.
Yeah, I agree also. That report from Norway, many of those patients were terminally ill. They had really serious illnesses. And we don't know if those 23 deaths are above the baseline for what would have happened anyways. And we don't know exactly what the relationship was in terms of timing with the vaccine. So certainly the elderly are at high risk for complications from COVID, and nursing home patients have been a high priority. So I agree with Ms. Carmen. I would go ahead and get her vaccinated. My 92-year-old mother got vaccinated, and I would encourage the same.
Thank you.
Go
ahead, Rose.
May I add, it might be helpful to think, draw some parallels, or think there are side effects to any number of medications. If you are prescribed a medication, there are instructions provided by the pharmacist, and the pharmacist, those instructions always include adverse reactions. So it might be worth thinking about, it might not be useful to try to put COVID in a special category in this sense. Think of penicillin. Think of any medication anyone could take. The chances of adverse reactions are rare, slim. But depending on the individual, they're possible. The one thing I would like to add is, following the vaccine, you are required to remain at the site for a specific period of time before you leave, because adverse reactions, generally, if it's going to be an adverse reaction, it will occur within a reasonably short period of time.
Thank you, Ms. Strickland. I'm trying to get to everyone at least once. There's a couple of folks with multiple questions, so we'll get to that second round if we can. Here's a question from Kim Butler, who makes some interesting points about possible sources of skepticism, but her question is this like the flu vaccine in terms of being targeted to a particular strain? If COVID keeps mutating, will vaccines designed for the original versions be equally effective? And there's a couple of related questions about the vaccine in response to reports of the different strains of COVID. Carmen, go ahead.
So I will preface this by saying that my knowledge is limited to within the vaccine trial I am involved in. But so right now, the vaccines that we have available, they are targeting a specific protein. So it's like saying I'm coming at you with both my hands, but you're getting rid of one so I can hurt you a little less. Despite the variants so far, there's reason to believe that the vaccines are still going to get rid of that extra hand and still be able to target the particular protein. And that's based on what we know so far. So that's all I wanted to add.
I'll throw in my 2 cents also. So there's the variant that's been identified from the United Kingdom that is now present in the United States and New York also. As far as we know, the vaccine looks like it's still going to be protective of that variant. There is a variant in South Africa and another one in Brazil that they're looking at carefully. The one in South Africa in particular, the Moderna vaccine still, and probably the Pfizer as well, still look like they're going to be protective. Maybe not as protective, but they're still looking at this. There is some discussion that maybe there may be a third dose, a third booster shot for the vaccine to make sure that people are protected against this variant. And just one other thing, like Carmen was saying, these strains mutate. The 2 vaccines that are out there, the Pfizer and the Moderna, are easy to change, and so that they can modify the vaccine very quickly to adapt to any variant that looks like it's going to be a problem. So, whether we need a coronavirus vaccine like we need the flu shot every year, time will tell. Hopefully not. The vaccines target the spike protein that Carmen was talking about, and they target very conserved areas of the spike protein. So hopefully all these variants are still going to be covered by these vaccines. So, we're cautiously optimistic that with all these variants, the vaccines are still going to be effective.
So maybe related to that question is another from Kenya, who asks, is there a difference between the Moderna and the Pfizer vaccine? Is one better to get than the other?
No, you get whichever one you can get first. They're both about 95% effective. They're both based on the same technology. I would get whichever one you can get first. To me, they're the same.
Yeah, and I wanna stress that get whichever vaccine is offered to you. Both of the Pfizer and the Moderna vaccine are mRNA vaccines. So they're just sending a message into your body, watch out for this guy and here's how you get him. So it's really basic information that is very helpful for our bodies. So no reason to pick one over the other at all.
Thank you. So this is a question specifically for Rose. Sue Yellen asks, were you chosen to be a part of the focus, the testing, because you were on that flight that you talked about at the beginning?
No, I was not.
Can you talk about why you were chosen?
I I'm not sure, but I suppose it might have had something to do with, I am a patient. Most of my care is provided at Cornell. And I assume perhaps that might have been a source for some of the participants. I didn't ask, didn't really matter to me. But no, it was unrelated to the flight.
It's an amazing story. It sounds like a film. Here's a question from Shannon, who mentions that early on, folks 75 and older in our area had difficulty getting appointments for the vaccine. And she mentions other areas that seem to receive the vaccine very early and asks if that represents a disparity.
Potentially. Unfortunately, I think the rollout was so sloppy and so limited, and still is, that it's not, I don't think it's a clear-cut answer. I think we can all agree that a much better job could have been done, especially, as Rose said, we have so many resources and we've kind of been in worse shoes before. So I think first and foremost, I would blame it on just sloppy rollout and lack of planning, unfortunately.
Here are a couple of related questions from Virginia. Virginia asks, does the vaccine have any adverse effect on fertility? And is there a way to determine that? And also, are the current vaccines safe for children? Dr. Quale, do you want to speak to that?
Okay. So the clinical trials did not include pregnant women. So there's not much information regarding pregnancy or fertility or breastfeeding. The CDC and the scientists have looked at this carefully, and there's no biological reason why there should be an adverse effect on a pregnant woman or someone who's breastfeeding. The RNA gets destroyed very quickly in your body. Once it does its job, your body gets rid of it, so it doesn't hang around very long. And the CDC has said that if you are pregnant, you should weigh the risks versus the benefits very carefully. But being pregnant or breastfeeding is not a reason to not get the vaccine. And if you are at high risk and you are pregnant or breastfeeding, really you should be encouraged to get the vaccine. But that's something you really need to discuss with your healthcare provider and carefully weigh the risks versus benefits. You know, that's a special population that unfortunately was not included in the vaccine trials. So like I said, we don't have a whole lot of information, but there's no biological reason why there should be a particular adverse effect. Like I said earlier, this does not get into your DNA. It doesn't change anything. It just goes in, it makes your body produce an antibody, and then it's destroyed. So that's my answer.
Thank you. And this may be connected as well. Laura Johnston asks, just like some people who are allergic to eggs cannot take the flu vaccine, is there some allergen in the COVID vaccine that will prevent some people from getting it?
Okay, that's a very good question. So some of the big issues have been allergies. And if you got the first dose of the vaccine and you had a serious immediate allergic reaction to the first dose, and by that I mean right after you got the vaccine you had hives, swelling, shortness of breath, then you shouldn't get the second dose of the vaccine. And that makes common sense. If you're, the CDC and the FDA have said that if you're allergic to any of the ingredients of the vaccine, with an immediate allergic type of reaction, then you should not get the vaccine. And the compound that seems to be the culprit for both the Moderna and the Pfizer vaccine is a chemical called polyethylene glycol, or PEG. And that is a substance that is ubiquitous. It's found in toothpaste, it's found in skincare products, it's found in antacids, it's found in laxatives. The number of people that are allergic to PEG, that compound, seems to be extremely small. Maybe about 4 cases per year in the United States are reported. So if you are one of those unusual people that know that you're allergic to polyethylene glycol or polysorbate, which is a related compound, then you should not get the vaccine. The more common question that comes up is if you've had a serious allergic reaction to another vaccine, should you get the coronavirus vaccine? So if you had hives or something after a flu shot or a tetanus shot, should you get one of these vaccines? The CDC and the FDA has said that that is not a reason not to get the vaccine. It's not a contraindication, but it's a precaution. And again, it is something that you should weigh carefully and talk to your healthcare provider, weigh the risks versus the benefits. If need be, you can see an allergist to help you make that decision whether you should get the vaccine. But it is not related to egg allergies or people that are allergic to penicillin or sulfa drugs or peanuts or anything else. It's totally unrelated to that. So, you know, again, the number of people that have had an anaphylactic or a serious allergic reaction to a prior vaccine should talk to their healthcare provider and help them weigh the risks versus the benefits. Again, that's a very small number of people, and you know, the vast majority of the population should be eligible to get the vaccine.
All right, we're almost out of time. We have time for maybe 1 or 2 more questions, and then if the panelists would like to say anything in conclusion, we have time for that too. Ada Terry asks, if you are vaccinated, do you still need to wear a mask? I see nodding. Can you elaborate?
So yes, if you are vaccinated, you still need to wear a mask. You should still just be hanging out with the people who you live with, and you should still be taking the same precautions. I think it would help to understand that the goal of the vaccine is to prevent disease severity. So the goal right now isn't to prevent you from getting COVID, but rather if you get it, you have a less chance of dying from it or developing serious symptoms. And so it is a tool along with wearing our mask to continue protecting ourselves. So yes, keep wearing your mask.
And then maybe for our final question, Virginia asks, what culturally competent steps is Kings County Health and Hospitals taking to address vaccine skepticism in the community?
We are having our leadership people, nursing in particular, have taken a big role in trying to educate both staff and patients to get the word out. The Department of Health, I know, has been developing an educational blitz for people. So you know, we're trying to reach everyone, and hopefully everyone can identify with people that have gotten vaccinated. And as more and more people share their stories, I hope the trust in the vaccine continues to grow.
Thank you, Dr. Quale. That seems like a great place to wrap up. Brenda or any of the panelists, do you have any words of conclusion?
Well, if not, I'd just like to thank Dr. Quale and Carmen and Rose. This was great, and we see that we have to do more of these. This is not going away anytime soon. So this would be one way to educate the public and our community, especially with there's so much skepticism, especially in terms of people of color. So we need to continue the discussion. And this is a community event, and I was urged to ask PLGNA to please do this by two people in the neighborhood, Loretta Lambert and Sandy Tate. So I just want to thank them, for saying, listen, PLGNA has to do something, and more organizations must, get involved. And I thank Celeste for telling us about Rose's journey, and Carmen for just doing a tremendous job of educating the community about this, and of course Greenlight, who's always available to help us and sort things out. And there's I first had to get in touch with Warren Burke and Francisca Arnott, who are, they work, I guess something, I forgot the title, but it's basically like community liaisons. And so I got in touch with them. And then Keisha, who says I can just call her Keisha, name, I think it's Jill's, who got in touch with the doctor. And, this is a great start, and thank you so much.
Thank you, Brenda, and to everyone.
And the board members. We have a board that works so hard. Virginia, who is putting our our information so that you can email us, and Deborah and Nelson. There's so many people that help with this. Thank you.
Thanks, Brenda. I just wanted to mention that if folks want to hear this again, or they want to share it with others, we'll have the recording of this event on Greenlight Bookstore's YouTube channel within the next couple of days. And Brenda, could you just repeat the email address if folks have ideas for future events or future discussions?
Sure. So it's PLGNA@gmail.com. Okay, and I see that Virginia has put it at, she's put it in the chat.
All right, thanks again, everyone, for being a part of this. We appreciate your time so much. Thanks for all of the good work that you do.
Thank you so much.
Thank you.
Have a good evening.
Bye.
Good night.